All right, fellas, this has been requested and we're giving it to you today. We're talking about prostate issues and ED, what you can do about it. If you have prostate issues or have had prostate cancer, prostate surgery, and you're dealing with erectile dysfunction, well, we're talking about that today. In particular, we're talking about the prostate and erectile dysfunction connection. And of course, I want to give you some things that you can do to make sure you don't have this situation to begin with. And hey, this is Brian, AKA Uncle B, and for the last 23 years, I've been a men's performance coach with African Fly, now known as GoodWood. And we get this question a lot, so I had to dive deep into the research, and we're going to give you as much information in this condensed period as possible, but it's really important. Fellas, if you don't have prostate issues, I need for you to pay attention because you need to prevent it. One, and two, we need to pass this message along to as many guys as possible. It could even affect your own family, your own son. Stay tuned. And today specifically, we're going to dive into ED, make sure we're clear on exactly what we're talking about. Then we're going to go into what happens with prostate cancer after the surgery and even with prostate enlargement. And of course, we're going to dive into how to prevent all of this stuff to begin with. And I have to give a quick shout out to Leonard Miller and Rodney Johnson. They specifically hit me up in the comment section, asked about this. Gotcha, fellas. And stay tuned for next week because we're going to be talking about the foods that you can eat to naturally help you prevent and also deal with the symptoms of prostate issues. And of course, if you like what you hear, go ahead and hit that subscribe button, that like button, that notification bell so we can get some more of this information to you. And what I'm going to do, even as serious as we are going to be today, is break this down till it cannot be broken anymore. All right, let's talk about erectile dysfunction because a lot of times people think it just means that I can't get up. That means I have erectile dysfunction. That's not what it means. Basically, we're talking about you can't have an erection for sex a good 25% of the time. It needs to be, a lot that's going on. We're not talking about the normal thing of like, oh, I'm just not hard right now. That happens occasionally. That's not what we're talking about. We're talking about the serious side of it where you just can't get up at all. This is when you want to, that 25% of the time. And of course, erectile dysfunction can be caused by a whole bunch of different things. We're talking about diabetes, hypertension, things like that. But today in particular, we're talking about prostate issues. And just understand, an erection is a matter of hydraulics. We're talking about blood flow. Basically, we're talking about blood fills the penis, gets firm, and so therefore you have an erection. And that's all a combination. We're talking about blood vessels, hormones, your own psyche. And when it comes to erections, it is a use it or lose it situation. This is really important for my guys who do have ED. It's like, well, yeah, you still need to get blood flow going down there. You still need to, hey, even if it isn't working for you, you have to keep the blood flow in your entire body and down there working. That's the reason why I say, I'm not against masturbation because that does get your blood flow. If you don't have the blood flow going down there, eventually, without the blood flow, the oxygen, you're actually going to cause scarring down there. So it becomes harder and harder to get your erections back up. Now let's talk about this prostate cancer, and especially when it comes to surgery. Surgery for prostate cancer can sever some of the nerves or arteries that are needed for an erection. Radical prostectomy, that's removal of the prostate gland. When it comes to that, the estimates of how many men will regain their ability to have erections vary widely, and we're talking about from 25% to 80%. That's a huge gap. Even so-called nerve-sparing surgery, these techniques themselves even lead up to 50% of guys ending up with erectile dysfunction anyway. All of this can depend upon different variables, and we're talking about the patient's age, the surgeon's techniques and their skills, and also the location of the tumor. Even when the nerves are not permanently impaired, it can still take 6 to 18 months for the nerve endings to get repaired, to overcome the trauma, get connected back up, and everything working. You see how serious this is? Even radiation treatment for prostate cancer can lead to ED issues. This is because it's actually harming the erectile tissue. Even some of the hormone therapy medications can cause erectile dysfunction. I mean, basically, yeah, you're messing with your hormones. There's going to be some issues. And let's talk about the prostate cancer itself. In its advanced stages, it can spread to the nerves and the arteries that are necessary for an erection. So let's talk about that nerve-sparing prostectomy. That is when the doctors are trying to avoid cutting nerves near your prostate. This gives you a better chance for keeping normal erectile and urinary function when you recover. but we're talking about over a period of time. Within 1 year, 40 to 50% of men have recovered. 1 year. After 2 years, we're talking about a good 30 to 60% that will recover to pre-surgery conditions. Men who have benign prostatic hyperplasia, BPH, a non-cancer enlargement of the prostate, may also experience erectile dysfunction and ejaculatory problems. Although BPH by itself doesn't normally cause these problems, some of the treatments used for BPH can actually still cause these problems. You can actually overcome BPH issues with lifestyle changes. I know this to be a fact because I had BPH and I took care of the lifestyle changes. Doing much better, not an issue at all. 3 years later. And of course, as always, we talk about this a lot. Whenever you're getting those medications, it's called the internet. You're on it right now. Type that in. See if it has any issues with your erections. And then if it does, talk to your doctor, see if there's some alternatives. Always, of course, change your lifestyle. Now, let's be very clear. Let's be honest. Let's be upfront. This is the reason why I'm saying to spread this around to your sons, to your neighbors, to your friends, so they can avoid getting prostate issues. Even with the surgery, even with the advanced medicine, you still could end up with erectile dysfunction. There's no way around it. The best way not to have this issue is not to have prostate issues to begin with. So let's talk about that, how not to have these issues to begin with. And of course, the first thing on there is maintain a healthy weight. And that's because obesity is linked to prostate issues and prostate cancer. Get regular exercise. No surprise there. Stop smoking and drink less. Increase your vitamin D. Get out into the sun where 80% of vitamin D comes from. Hydrate daily. I'm not even gonna waste any time. Nice prostate. And of course, get your veggies in, eat more vegetables. So let's talk about the causes of prostate cancer really quick. First, we're talking about the hormonal changes that occur as you just get older. The balance of hormones in your body changes as you get older, and this may cause your prostate gland to grow. Having a blood relative who's already had these issues, like a brother or a father, means that you more likely can have this issue. So pay attention to how to avoid this. And if you have an issue with diabetes and heart disease, you may be using beta blockers, and these can actually lead to issues with BPH. Fellas, whatever you can do to avoid prostate issues, make sure you're doing that, because once you have this issue, your prospects for having erectile dysfunction goes up tremendously. If you have any nerve damage, we're talking about 3 months to 2 years before you're getting back into having erections again. And just to be clear, all the things we talk about on this channel in terms of getting yourself to a healthy erection, getting yourself to an 8, 9, and 10 on the sexual performance scale, all of that will help you prevent prostate issues. That simple. And question of the day, and guys, I need for you to be honest. If you had prostate issues or if you had BPH, let us know down in the comment section how you dealt with it, what your experience is. We need to know, we need to spread this information. And as always, if you have any other comments, leave those down below. We do check those out. And of course, if you like what you heard, go ahead and hit the subscribe button, the notification bell, so you can get some more of this information to you. And this is Uncle B saying, get your game up and go hard. Peace out.